In this rural school outside of the city of Pune in Maharashtra, India, young people are taking part in US NGO Child Family Health International's Catch Them Young education program aimed at 12 to 19-year-olds.
In this Catch Them Young program, we give education about how menstruation starts, what precautions one shall take during the menstruation, how secondary sexual characters develop, how fertilization and pregnancy occurs, and how to prevent unwanted pregnancy. At the same time, we talk about the addictions, especially the cigarette smoking, tobacco chewing, alcohol, and while giving this type of education, we also give importance to the exercise and diet, or the healthy diet which shall be consumed by these adolescents.
The programme encourages young people to stay in school, delay marriage and plan their families.
I heard about the programme when I was younger and already had one child. Catch Them Young emphasised birth spacing, having 3 or 4 years between children. So after that I made sure I didn't get pregnant for 3 years. I used the pill which was recommended by the programme.
The community as a whole benefits. There's advice on hygiene, water sanitation and the building of latrines, as well as blood donor and immunisation campaigns. Local parents and grandparents back the scheme.
After following the programme, I decided my daughters should complete their education without any breaks, which I wasn't able to do myself. Now one of my daughters is studying medicine and another is working as a tax officer.
I'm a grandmother now and I was married at an early age, but I now understand the problems with teenage marriage and tell my daughters that they can't get married until they are 20. I also tell them that they have to get an education and not drop out of school.
Another aspect of Child Family Health International, or CFHI's work, is bringing international students working in the field of health to developing countries. The students bring much needed medicines and learn from local medical experts in a different health setting.
It'll help with my medical career just by giving me a different perspective of medicine that you wouldn't necessarily see in the US. There's so many models of care in India that at all different levels, small to big, serving different populations. And I think as a physician, it's good to be aware of those different models of care and how they can best serve the community in which they're in.
I haven't begun my medical studies yet, so any kind of clinical exposure prior to is always beneficial for me to become a better physician. And in addition, I am interested in doing international work, and so having experience in an international setting, seeing healthcare in a different region will prepare me to become a better physician and to be able to serve different populations.
When these students are here, definitely there is an exchange of ideas among the local community, among the doctors and the students. So it broadens the thinking of the students as well as the local people here. Another benefit that we have observed from our programs is that the local communities get more confidence in their own doctors when they see that these doctors are teaching international students.
CFHI was established over 20 years ago and now runs 22 programs in 5 countries: India, Bolivia, Mexico, South Africa and Ecuador.
We've been working in a way that is socially responsible. By that we mean that we engage communities on as much of a level playing field as we can. We work with communities by building on their strengths, by involving community members in our process of developing programs. We really want at the local level for the people to be taking ownership of the programs.
But there's still a great amount to, there's such great things to learn from these communities abroad, and our focus has always been that the experts are really those that live in those communities, and that they are the ones that can teach us. And it may not be a medical fact that they're teaching us, but it's about the culture and about health, and health isn't just medical illnesses, it's about the people and their culture and their knowledge and their literacy and their finances and their social network and their environment.